Hello, my name is Camille. As a parent, there is nothing more precious to us than the safety and well-being of our children. In those first few months and years, our babies are exploring the world with boundless curiosity, but they are also incredibly vulnerable. Accidents can happen in the blink of an eye, and in those critical moments, knowing what to do can make all the difference. It's a thought that can keep any parent up at night, the what if, scenarios that play out in our minds. But fear can be replaced with preparedness, and anxiety can be soothed with knowledge. That's why I wanted to create this video. This isn't about creating fear, it's about empowerment. Knowing the fundamentals of first aid for your baby is one of the most important skills you can acquire as a parent or caregiver. It's about having the confidence to act calmly and effectively when it matters most. These aren't just abstract medical procedures. They are practical, life-saving techniques that can protect your little one from harm and give you peace of mind. Today, we're going to walk through some of the most common emergencies you might face with an infant. We'll cover everything from choking and CPR to burns and fevers. Think of this as your foundational guide, a starting point to build your confidence. These are the essential tips that I believe every single parent should know, etched into their memory, ready to be used if ever needed. Let's begin this journey to becoming a more prepared and confident parent together. One of the most terrifying scenarios for any parent is watching their baby choke. Their airways are so small, and it can happen with something as simple as a small piece of food or a tiny object they've put in their mouth. The first and most crucial step is to assess the situation. Is your baby coughing or making noise? If they are, it means air is still getting through. Encourage them to keep coughing, as this is their body's natural and most effective way to clear the blockage. Stay close and watch them carefully, but do not interfere with their attempts to cough it out. It's our instinct to panic and intervene, but a strong cough is a good sign. However, if your baby is silent, cannot cry or cough, or is making high-pitched wheezing sounds, you must act immediately. This is a sign of a complete blockage. Carefully position the baby face down along your forearm, supporting their head and jaw with your hand. Their head should be lower than their chest. Using the heel of your other hand, deliver 5 firm back blows between their shoulder blades. The combination of gravity and the force of the blows is designed to dislodge the object. Remember to be firm, but not violent. The goal is to create a strong vibration and pressure that pushes the object out. After the 5 back blows, if the object is still not clear, you need to transition to chest thrusts. Carefully turn the baby over, so they are now face up on your other forearm or thigh, again keeping their head lower than their chest. Place 2 or 3 fingers in the center of their chest, just below the nipple line. Give 5 quick, firm chest thrusts, compressing the chest about 1.5 inches deep. This action is similar to CPR compressions and is meant to force air up from the lungs to push the object out. Continue this cycle of 5 back blows followed by 5 chest thrusts until the object is expelled, the baby begins to breathe, or help arrives. If at any point the baby becomes unresponsive, you must begin infant CPR immediately and call for emergency services. The thought of performing CPR on a baby is daunting, but it is a skill that can be the bridge between life and death. If you find your baby is unresponsive and not breathing or only gasping, you must begin CPR immediately. Time is absolutely critical. First, shout for help and have someone call 911 or your local emergency number. If you are alone, perform CPR for 2 minutes, that's about 5 cycles, before you stop to call for help yourself. Place the baby on a firm, flat surface like the floor or a table. We need a hard surface to ensure the chest compressions are effective. To begin compressions, place 2 fingers of one hand on the center of the baby's chest, right below the nipple line. Gently but firmly, push down about 1.5 inches. The key is to do this fast, at a rate of 100 to 120 compressions per minute. A good way to keep rhythm is to think of the beat of the song Stayin' Alive. Perform 30 of these compressions. It might feel unnatural to push on such a tiny chest, but these compressions are vital for circulating oxygen-rich blood to the brain and other vital organs when the heart has stopped. After 30 compressions, you will give 2 rescue breaths. Gently tilt the baby's head back to a neutral or sniffing position. Be careful not to tilt it too far back, as this can block their airway. Cover the baby's mouth and nose with your mouth to create a seal, and give 2 gentle breaths, each lasting about 1 second. You should see the baby's chest rise with each breath. If the chest doesn't rise, reposition their head, and try again. Immediately after the 2 breaths, go right back into 30 chest compressions. Continue this cycle of 30 compressions and 2 breaths until the baby starts to breathe on their own, an AED becomes available, or medical professionals arrive to take over. Burns are a common household injury, especially with curious little ones around hot liquids, stovetops, or electrical outlets. When a burn occurs, your immediate priority is to stop the burning process. This means removing the source of the heat and cooling the affected skin as quickly as possible. The best way to do this is with cool, running water. Hold the burned area under the tap for at least 10 to 20 minutes. This may seem like a long time, but it's essential for pulling the heat out of the deeper layers of the skin and can significantly reduce the severity of the burn and the pain. It's just as important to know what not to do. Never use iced water or any kind of greasy substance like butter or ointment on a fresh burn. Ice can cause further damage to the delicate skin by causing a frostbite-like injury on top of the burn. Ointments and butter can trap heat inside the skin, making the burn worse, and they can also increase the risk of infection. Stick to cool, running water. After cooling the burn, you can cover it loosely with a sterile, non-stick dressing or a clean cloth to protect it from infection and reduce pain from air exposure. You need to know when to seek professional medical help. For babies, any burn that is larger than the size of a coin or any burn on the face, hands, feet, or genitals requires immediate medical attention. You should also see a doctor for any burns that cause blisters look deep or appear white or charred. Electrical burns and chemical burns always require an emergency room visit, even if the skin looks fine, as they can cause significant internal damage. When in doubt, it is always better to err on the side of caution and have a medical professional assess the injury. A high fever in a baby can be very frightening for parents. It's important to remember that a fever itself is not an illness, but a sign that the body is fighting one. For infants under 3 months old, any fever of 100.4 degrees Fahrenheit or 38 degrees Celsius is considered a medical emergency, and you should contact your doctor or go to the emergency room immediately. For older babies, you can often manage the fever at home by keeping them hydrated and comfortable. Dress them in light clothing and offer plenty of fluids like breast milk or formula. You can consult your pediatrician about using fever-reducing medication like acetaminophen or ibuprofen, but always confirm the correct dosage for your baby's age and weight. A fever can sometimes trigger a febrile seizure, which can be an incredibly alarming event to witness. A febrile seizure might involve the baby's body stiffening, their limbs twitching or jerking, and they may lose consciousness. As terrifying as this looks, the most important thing you can do is stay calm and focus on keeping your baby safe. Do not try to hold them down or restrain their movements. Instead, gently lay them on their side on a soft surface, like the floor, away from any hard or sharp objects. This side position helps keep their airway open and prevents them from choking on any saliva or vomit. Do not put anything in your baby's mouth during a seizure. This is a dangerous myth and can cause injury to their teeth, jaw, or even block their airway. Time the seizure. Most febrile seizures last for less than a couple of minutes. You should call 911 or your local emergency number if the seizure lasts longer than 5 minutes, if your baby has difficulty breathing afterward, or if you suspect it was caused by something other than a fever. Even if the seizure is short, it's always recommended to have your baby evaluated by a doctor afterward to determine the cause of the fever and rule out any other serious issues. From a scraped knee during their first attempts at crawling to a more serious cut, bleeding is something every parent will have to manage. For minor cuts and scrapes, the first step is to clean the wound. Wash your own hands thoroughly, then gently wash the area around the cut with soap and water. Try to keep soap out of the wound itself, but rinse it thoroughly with clean water to remove any dirt or debris. This is a crucial step in preventing infection. After cleaning, you can apply a thin layer of an antibiotic ointment and cover it with a sterile bandage. For more significant bleeding that doesn't stop easily, your primary goal is to control the blood loss. Take a clean cloth or a sterile gauze pad and apply direct, firm, and continuous pressure to the wound. Don't be tempted to lift the cloth to check if the bleeding has stopped. This can dislodge any clot that is starting to form. Just keep applying steady pressure. If the blood soaks through the first cloth, do not remove it. Simply add another cloth on top of it and continue to apply pressure. Elevating the injured limb above the level of the heart can also help to slow the bleeding. Knowing when to seek medical attention is key. You should go to the emergency room if the bleeding is severe or doesn't stop after 10 to 15 minutes of direct pressure. Also, seek help if the cut is very deep or gaping, if it was caused by a dirty or rusty object, or if it's the result of an animal or human bite. Deep wounds may require stitches to heal properly and to minimize scarring, and some injuries carry a risk of tetanus or other infections that need professional medical treatment. Trust your instincts. If a cut looks serious to you, it's worth getting it checked out. We've covered some incredibly important and potentially life-saving information today. From choking and CPR to managing burns and bleeding, these skills form the bedrock of infant first aid. My goal was not to frighten you, but to arm you with knowledge. Because when you are prepared, you can replace panic with purpose. In any emergency situation involving your child, your calm demeanor is one of the most powerful tools you have. Take a deep breath, assess the situation, and recall the steps we've discussed. Your ability to remain composed will not only help you think more clearly, but will also be profoundly reassuring to your child. Remember that this video is a guide, a starting point. While these tips are essential, they are not a substitute for professional medical help. Never hesitate to call your pediatrician or emergency services if you are ever unsure or if a situation feels serious. Your parental intuition is strong, trust it. If you feel that something is wrong with your baby, it is always better to seek a professional opinion and be told that everything is fine than to wait and wish you had acted sooner. The single most valuable step you can take after watching this is to enroll in a certified infant first aid and CPR course. Hands-on training with a qualified instructor, where you can practice these skills on mannequins and ask questions in real time, is truly invaluable. It builds muscle memory and solidifies your confidence in a way that watching a video alone cannot. Thank you for taking this time to empower yourself for the sake of your child. Stay safe, stay prepared, and cherish every moment.